All right, hello to everyone that's just joining in. We're going to give it just a minute or two to let all the attendees come in and get settled in, and then we will turn it over to Mauro. All right, we'll give it about another minute just to let any more attendees come in, and then we will get started. All right, I think we are just about ready to get started. So I am going to turn it over to Mauro's webinar. Please keep in mind if you have any questions, Mauro will be answering them in the chat during the webinar session. So please ask your questions during then. There will be a little bit of extra time at the end just to kind of answer any questions that are left in the chat afterwards. But other than that, he will be answering everything live during the webinar itself. So with that, I will be turning it over to Mauro's webinar now.
Hello everyone and welcome to this webinar on Spark NLP models for oncology. I'm Mauro Nivaso-Fidani, I'm from Argentina. I'm a medical doctor and a data scientist at Johnson Labs, and I'm very glad to be here with you today. So these are the topics that we're going to cover today. At first, I'm going to talk about some oncology models, different types of models, how to use them, how to select the best one for your use case, and also I will show you some examples. Then I will talk about pre-trained pipelines. I will show you the ones that we have and also how to use them. And at the end, I'm going to show you a sample use case so that we can see how you can apply what you have learned in this webinar. Okay, so we have four. I'm going to cover four types of oncology models: named entity recognition, also known as NER, entity resolution, relation extraction, and assertion status. These models were trained using data annotated by our in-house team of annotators, of medical doctors, who also developed the annotation guidelines for this and annotated and reviewed the data. They did all this using the Annotation Lab, which is an annotation tool. I really recommend you to use it if you're planning to annotate data. I left a link at the end of the presentation if you want to take a look at it later. So, as I was saying, the first type of model that we're going to cover is NER models. These models, these models are used to extract and classify parts of the text. Okay, for example, in this slide, you can see how an NER model was used to extract, for example, 65 years old as age, and woman as gender, and many other things were extracted and classified as cancer surgery, staging, and so on. Okay, in this slide, you can see a list of NER models, of oncology-specific NER models. There are other models in Spark NLP for healthcare that also extract oncology-specific, like NER-JSL, but I didn't include it here because that's more generic. And you can see a list of more than 10 models, and you can also see the group of entities that each model extracts. Those groups are diagnosis-related entities, tests, treatments, posology, response to treatment, demographic information, anatomy, and temporal information. Different models also have different levels of granularity. This means that high granularity means that the model has the taxonomy has more labels, and lower granularity means that it has fewer labels. So as you can see, the most complete model is NER oncology. It extracts data for each entity group at a high granularity. And the rest of the NER models are specific, sometimes for treatment, sometimes for tests, and so on. As you can see, there's some overlap between different models. So a good question here would be how to select the best one for your case. What I would recommend you to do is when you're developing your pipeline, your NLP pipeline, you can include more than one NER model, and then you can check the extractions of those models to see which one fits best your use case. And also, if you're happy with more than one of them, you can always use a NER merger to combine the extractions of multiple NER models. Okay, so the models that includes the highest quantity of entities is NER oncology, and it has around 50 entities. I will not go. I will not talk about each of these entities, but I think there are some in particular that you may be interested in having more detail. So this is why I included this slide and the next one. So we have anatomical entities, including direction, which extracts like left, right, upper, lower, and then other entities for bone, brain, breast, etc. Demographic entities for age, gender, race, ethnicity, smoking status. Also one entity for death entity. This is to extract words like died or any word referring to someone dying. Then we have diagnosis-related entities. The most important one is cancer diagnosis that is used to extract, for example, breast cancer or breast carcinoma. So in that case, the anatomical site is included in the extraction. And then other information like adenopathies, metastases. Here you also have a grade entity that extracts, for example, grade 1, but also it extracts differentiation, cell differentiation, like well differentiated, those kinds of terms. You can also, there's also a label to extract performance status, both ECOG and Garnowski status, and there's also one for staging, for TNM and other staging systems, and also, for TNM and other mentions of stagings, including words like advanced for in advanced cancer, for example. And tumor finding is another important label that's used to extract words like tumor, mass, or lesion, or any word that refers to the tumor itself, not to the disease, but to the tumor. Okay, so moving on with the entities, there are many posology entities. Some of them are specific for oncology, like the ones referring to cycle count, cycle day, cycle number, and other ones are unspecific, like duration or frequency. There are also entities related to the response to the treatment, like line of therapy that is used to extract mentions like first line or second line, and also the entity response to treatment that is used to extract mentions of recurrence or cancer recurrence, and also bad response or good response. There are also temporal, like date and relative date, test entities and their test result, and like biomarker and their results, for example, and also many treatment entities like chemotherapy and cancer surgery. Okay, here you can see an example of the output of one model. Here I chose NER oncology, and you can see that it extracted many different parts of the text. It classified different parts of the text, including cancer surgery and cancer diagnosis and histological types such as mucinous type, stages, chemotherapy, and so on and so on. So with this model, for example, this is a good model. If you don't have any in specific that you want to extract, like treatment in particular or something like that, this is a good model to start working on, because it has a great variety of labels. Here you have another example of another model. This is NER Oncology TNM that extracts information related to the TNM stage of the patient. So here you can extract the cancer diagnosis, also any mention of staging, and also mentions of tumor and its descriptions, lymph nodes, and metastases. And just another example of extractions with NER oncology biomarker that extracts biomarkers and their results. Okay, so now moving on to the next type of models. Entity resolution models are used to map NER extractions to normalized terms. I'm going to show you here a model used to for ICDO codes. The name of the model is down there. So as you can see here, for example, in the first extraction, breast carcinoma, first an NER model extracted it as cancer diagnosis, and then an entity resolution model linked a code to that extraction and a normalized term to that extraction. And the same happened with the rest of the NER extractions that you can see there. One more thing to tell about entity resolution is that normally you don't want to use an entity resolver for all the entities that you get from your NER model. For example, you don't want to get an ICDO code for dates or for gender. So it's a good idea always to use to filter some of the NER extractions before using NER resolvers. And for that, you can use a chunk merger with a blacklist, as you can see here in this code. Okay, now let's talk about relation extraction models. These models are used to link NER chunks that are related one to the other. In this case, you can see I used a model to link tumor findings with sizes, and you can see how 2 centimeters, for example, was linked with its corresponding tumor finding, and so on. Okay, so this is the list of relation extraction models that you can use. So the difference among them is that some of them include some kinds of relations, some of them include them all with higher or lower granularity. For example, the first one extracts test findings, locations, dates, and sizes. So it relates, so it extracts those kinds of relations at a granular level. So you get those 4 types of relations. Then the second one, the level of granularity is much lower. You only get one label is related to or no relation at all. And then you have specific relation models for tests and the results, for biomarkers and the results, for locations and any other relevant entity, for dates and any relevant entity, and for sizes and tumors and metastases and lymph nodes. Okay, so when you use a relation extraction model, there are some parameters that you can fine tune to make your relation extraction model work better. One thing that I would recommend you to use always is relation pairs. So you include in the model only the combination of entities that are relevant in your case. For example, if you want to extract tumor sizes, you want to exclude from your pairs dates or any other kind of, or maybe treatments any other kind of entities that were extracted by your NER model but are not relevant for relation extraction. And in this way, you will reduce the noise from your outputs. In this slide, you can see an example of a relation extraction model. In this case, it is a RE oncology granular whip. As you can see, the first sentence, for example, 2 years ago, she noted a palpable right breast mass. 2 years ago was extracted by an NER model as relative date. Mass was extracted as tumor finding. And then this relation extraction model identified that there was a relation between those two extractions and that relation is a temporal one, right? Is date off. And something similar with the location relation, with the size relation, and also the model extracted a relation between the pathology test and the cancer diagnosis carcinoma. Here you can see another example where a model was used to get the relations between the biomarkers and their results. Okay, and this is the fourth type of models, assertion status models. These models are used to get information from the context of the NER extractions. They are usually used, for example, to get if an NER extraction is absent or if it is past or present or hypothetical. They are used for that kind of things. So, for example, the first sentence, the patient was diagnosed with breast cancer. That cancer diagnosis was identified as medical history. Then she was suspected to have metastases. Those metastases were classified as possible. And then her family history is positive for ovarian cancer. That cancer diagnosis was classified as family history by an assertion status model. Okay, so here you can see a table with different assertion models. Once again, I didn't include models that are not oncology specific, but it's always a good idea when you start developing your pipeline to include other kinds of assertion models like assertion JSL or assertion DL, and then see which one is the one that fits best your use case. So the difference between the different models is that they are usually used in different entity groups. For example, diagnosis, test, treatment, and so on. And also that they have different granularity, different labels or different classes. The one that is the most complete is Assertion Oncology Week, which extracts absent, family, hypothetical, past, possible, and present, all these classes. And okay. And when you use an assertion status models, something similar to what happened with entity resolver, my recommendation always is to filter before the entities that you don't want to get assertions. For example, you don't want to get the assertion from a body part. You want to see if it is absent or past because it may not make no sense. So in this case, you can use again a chunk measure for this with a blacklist. Here you can see one example similar to the one that I showed before with a possible extraction family. Also, there's a mention of a biopsy which was classified as past, and also a CT scan which was in the past, so it's past, and some metastases that are possible, and they were classified as such by the assertion model. Here it's a model, it's a binary model, assertion oncology treatment binary group. So in this case, this is the lowest level of granularity. You get either if a treatment is mentioned as something that happened, like present or past, or if it is mentioned as something that didn't happen, like something hypothetical or past. For example, here the patient underwent a mastectomy, that's present or past, and we recommend to start radiotherapy, that's hypothetical or absent. Okay, now let's move on to the next section. Let's talk about pre-trained pipelines. For those who don't know them, so these are a way to summarize or um, to use NLP pipelines in a simpler, much simpler way. So you can see here on the left side, you can see a pre-trained pipeline, how to use a pre-trained pipeline. So you load it and then you annotate something. And in the left side, you can see the full code that was used to create that pipeline. In this case, it includes more than 20 steps. So pipelines, if you don't have that much experience or if you're just starting with a project, it's always the best way to start. But then if you want to customize something, you will always have to create your own pipeline and with all the steps. So regarding oncology-specific pipelines, we have 4 of them. Oncology with one general with all kinds of entities, then one for diagnosis entities. This one includes NER assertion relation instruction, and it also includes entity resolver, the ICDO resolver that I showed before. Then one for biomarkers and one for therapies. And if you use these pipelines, you don't have to worry about what I mentioned before of relation pairs or using chunk measure and blacklists to filter entities, because all of that is was considered when creating these pipelines. Okay, so now let's talk about a use case. I just wanted to share with you something similar to what you may find in real world and how you can approach using our models, our oncology specific models. So let's imagine that we have to recruit patients for a clinical trial. In that case, you may have inclusion criteria like female, like gender female, or an age range, and then diagnosis, no previous cancer treatments. So to approach these kinds of problems, you have to think of a strategy. And in this case, this is how, in general, what you should do is combine different types of models, okay? So, for example, if you want to get the gender of the patient, you will use NER models to extract the gender, but also you will use assertion models to know if those mentions of gender refer to the patient or to someone else, for example. Then for cancer diagnosis, for breast cancer, again, you will use NER. You will always use NER. That's like the basic part of it. And then on top of that, you will have to use like assertion or entity resolver to filter and to get only the kinds of extraction that you want to get at the end. And for staging, something similar. You will use NER. You can use NER oncology or any other oncology TNM, something more specific, and then combining that with relation extraction or assertion, you will get what you want. And the same with biomarker, you will always have to use relation extraction to get biomarker results and to know which result refers to which biomarker, and something similar with cancer treatments. To know if they are present or absent or mentioned as hypothetical, you will have to use NER plus assertion. Um, okay, so that was the final part of this webinar. I hope you enjoyed it. I hope you find it useful. I will leave you some links at the end, and thank you a lot for your time and your attention.
All right. With that, we will be having everyone here answer questions in the chat. It looks like there's a bunch of questions here at the moment. So Mauro and his fellow organizers will be answering those right now via the chat panel. Please keep in mind that everyone today will also receive a copy of today's webinar. They will get an email with a copy of the recording on it. So expect that shortly after the webinar ends. I apologize. I've seemed to have lost a connection to Morrow and the other organizers. Let me see if I can get them back on here to answer some of these questions here. I apologize for the delay. I'll try and give this just one more moment to get them back in here, and if not, then we'll have to figure something else out for the Q&A. Okay, looks like we do have Mara back in chat now. Okay, I do apologize. It doesn't look like we're going to be able to get Q&A up and running at this time. For now, you guys can forward all of your questions to John Snow Labs themselves, and we'll try and get those added as soon as possible and responded to. With that, I will be ending the webinar. Please keep an eye out for that email with a copy of today's session on it. And yeah, with that, I will be ending the webinar now. Have a good one.